Spine surgery often suggests large incisions, long hospital stays, and a difficult recovery. But what if some modern procedures let patients go home in under 24 hours? This is achieved with minimally invasive spine surgery, designed to reduce trauma to the body. We are talking about incisions as small as 1 centimeter to access and repair the spine. Now, we will show how these procedures work, the tech that makes them possible, and what to expect. The core idea is to avoid cutting muscles like in traditional open surgery. This philosophy drives all the benefits. A key tool is the tubular retractor. It gently separates muscle fibers, creating a narrow tunnel to the problem area. Because the muscles are not cut, they are preserved. This means less post-operative pain and maintained core strength. So, a smaller incision isn't just a smaller scar. It means less muscle harm, which leads to less pain and a faster recovery. This reduced trauma also means far less blood loss. This lowers the risk of infection and the need for transfusions. All this adds up to getting back to your life sooner. Patients often return to normal activities within weeks, not years. To picture how the retractor works, think of pushing a finger through tall grass. The grass separates but is not cut. Specialized long and narrow instruments are passed down this retractor, allowing the surgeon to work with precision. Once the repair is done, the retractor is removed. The separated muscle fibers return to their natural position, unharmed. Spinal endoscopy is another step forward. A thin tube with a high-definition camera provides a magnified, clear view inside. But with such small access points, how can surgeons be absolutely sure they are avoiding critical nerves? How do they see the unseen? Before we answer that, let's look at what kinds of common spinal problems are treated with these techniques. One common use is for discectomies, removing herniated disc material that is pressing on a nerve in the neck or back. It's also used for decompressive laminectomies. This procedure relieves pressure on the spinal cord from spinal stenosis. Even complex spinal fusions, which use rods and screws to stabilize vertebrae, can now be done with these methods. In each case, the goal is the same. Fix the structural problem while minimizing disruption to healthy surrounding tissue. While the benefits are clear, this is still a major surgery with risks like infection, bleeding, and potential nerve damage. This returns us to our question: how do surgeons navigate safely? The answer is a suite of advanced technologies. First is intraoperative imaging. Fluoroscopy provides real-time X-ray images, acting as a live GPS for the surgeon's tools. To protect nerves, surgeons use neuromonitoring. This system sends safe electrical signals and monitors their response in real time. If an instrument gets too close to a nerve, the system alerts the team instantly, preventing damage before it can occur. So we have techniques to reduce tissue damage and tech for safety. But surgery is pushing even further with robotics and AR. This is where everything connects. The precision from these new tools is what enables the faster recoveries we mentioned at the start. Robotic assistance doesn't replace the surgeon. It steadies their hand, helping place screws with sub-millimeter accuracy. Augmented reality overlays 3D spine models onto the surgeon's view. It's like having X-ray vision for intuitive navigation. And with 3D printed implants, surgical components are custom-made to fit a patient's unique anatomy for a perfect fit. So what does this all mean? The most important statistic is this: success rates are similar to traditional surgery, but the experience is different. You get the same long-term outcome with less operative trauma, less pain, less blood loss, and a much shorter hospital stay. Modern, non-invasive spine surgery isn't about a different destination. It's about a smarter, safer, and faster way to get there. If you are considering spine surgery, discuss with a qualified specialist if these modern options are right for your condition.